Good morning. Today is November 17th, 2021. This is the monthly board meeting of the COA board with the director of the COA department, Holly Lott. So I'm going to go through the script for remotely conducted open meetings. As a preliminary matter, this is Shashi Menon, chairman of the COA board. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jean Campanello,
Here.
Betsy Zwait,
Here.
we need Judy Goodstein,
Yes.
and we need Louise Russell.
Here.
Louise, I don't think I see your video. Oh, yes, you're back. All right.
Okay.
And from the staff, we are expecting Holly, who's here. I don't see the video. Holly's here. And Renee, who's here. And Christine Moriarty.
Here.
All right. The meeting is now called to order. And I will go through the remote meeting script. Good morning. This open meeting of the Council on Aging Board is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. For this meeting, the board is convening by Google Meeting as posted on the town's website, identifying how the public may join. Please be sure to press *6 to mute your device. This meeting will not feature public comment. Please wait until I open the item for public comment and press *6 to unmute your device. Finally, each vote taken in this meeting will be conducted by roll call vote only. Holly, do you want to introduce our new member? Before, are we going to introduce Holly?
Who are you referring to? I thought we met everybody.
Lucas. Lucas is
Yep. So we're going to get to that. So
okay.
Yep. So we're just going to hold off on meeting Lucas just so we can go through. That's going to be part of the outreach.
That's fine. That's fine. I just wanted to make sure that everybody knew who everybody else was.
Yep.
The first item on the agenda is to review and accept the minutes of the September and October meetings. First, I will start with the September meeting. Does anyone have any questions or comments regarding the September meeting minutes? Louise?
Yes, I had on the last part on I, where it says questions for the board members. And the question was, is there a way that wellness calls are being handled? The answer is no. I don't understand. Are they just not being handled, or there's no way to handle them? Or I think that should be a little more.
Betsy?
Let me, excuse me, let me clarify, Louise. I'm looking at, so the September minutes, no one was officially assigned to take those minutes, but I had taken my own notes. So
I understand that.
Yeah, but so I'm looking at my handwritten notes from that meeting. And when we got to that question, I think it said, the question was, is there a change in the way that wellness calls are being handled? And the answer was, no, there is no change. So I'm thinking, I'll go back and look, but did I leave out the word change?
Yes.
Okay, I'll modify that.
Yeah, that makes sense. Thank you, Betsy. I appreciate that.
Any other questions or comments?
Go
ahead, Louise.
I move that we accept the minutes of September 8th, 2021.
With the changes that you want to make?
Yes, yes.
All right, let's take a roll call vote on that. Jean,
Yes.
Betsy,
Yes,
Louise,
Yes,
Judy,
Yes.
motion is carried. Minutes are approved. Moving on to the October 2021 minutes. Anybody have any comments or questions? If there are no comments or questions, will someone make a motion to accept? Louise,
I move that we accept the minutes of October 13th, 2021.
Jean, are you seconding
I
that?
second.
The roll call vote, Betsy,
yes,
Jean,
Yes.
Louise,
Yes,
Judy,
Yes.
motion is carried and the minutes are accepted. We will move on to the financial report.
Shashi,
Louise, go ahead.
as we go into the financial reports, I noticed on the agenda that only 2 of them are listed. And we do discuss all the financial reports. So possibly those people who look at the agenda to see what's going to be discussed, I think maybe if we could list all the different things that board reports that we discuss, I think would clarify that for people looking at the agenda.
You want to talk about that, Holly?
We can add that in. To be honest, I don't know why it's only A and B. I obviously never even kind of figured, like, looked at it that way. I think at one time it was just financial reports, so we can absolutely make that change.
Any other questions? If not, Christine, please go ahead.
Okay, so starting with the FY21 budget summary, I apologize, I should say FY22 at the top. So starting with the formula grant, and as a reminder, this is just an estimate as we haven't received the formula grant funds for this fiscal year yet. We have $72,314.45. In the DOT account, we have $4,797.22. The shared winter streets grant, we have $5,019.42. The taxi livery grant, we have $13,069.50. In the gift fund, we have $23,716.41. In the revolving account, we have $28,615.91. And in the general fund, we have $20,832.22. Does anybody have any questions on the detailed reports that I gave out? I won't go over each of them, but if you have a question, we can talk about it. Jean?
Jean?
Would you just explain to me what the shared winter street grant is?
So that was a grant that our previous outreach coordinator, Elizabeth, had applied for. I apologize, I forget the terms. We were awarded the money at the beginning of this calendar year. And so the money was used for, we bought benches. So there was about 20 or so benches that we purchased and installed around town. 3 of them are here at the senior center. Most of them went to the schools in town. So the high schools, the middle schools, the elementary schools. We also used that grant funding to purchase salt shovels and scoops, as well as walking vests. So this was a really, really great opportunity that we were presented with. And I think the remaining funds were used for the installation of the benches. Originally, the town was going to install them themselves, but through discussions had decided to utilize Leone's Landscaping to install the benches for us. So that remaining amount was just left over for the installation of the benches.
Thank you.
Does anyone else have any other questions? Louise?
Yes, I was just, the formula grant, do we have any idea when that is going to be forthcoming? Has the state said anything about at that?
I have not received anything as far as a timeline. Once we have that information, we can certainly share that with you, though.
So if I may,
Holly, are you done? No,
No.
you're not. Go ahead, Holly.
so typically the funds are given to us from EOEA, and usually we get those at the latter part of the fiscal year. So we can expect those probably between April and May. We are fortunate in the fact that we can spend those funds prior to receiving the monies. Some towns do not allow that, but we can expect it between April and May.
Louise?
I also had a question about the DOT. I know several years back, we were having trouble in getting funds from them. And are they now making deposits regularly, or is there still a problem in receiving any monies from the DOT?
Christine, I'll take that. So right now we're not receiving any fares or anything like that. So as far as the DOT, I'm not exactly sure what you're referring to, Louise. The WRTA, they pay for all the maintenance of the 2 WRTA vans. We have not accepted any fares since COVID struck in 2020. So I'm not exactly sure what you're talking about as far as money is concerned.
Yes, it was my understanding that from years back that the DOT would give money to each senior center, and we had a hard time getting money from them. You know, we'd go for a couple of years and not receive any. And I noticed this is down to 4,700 now. So I know funds are not being, collected.
So Louise, so just to clarify, so the DOT account is for when we received grants. That's how the money gets into that specific account. I did apply for grants, but we won't find out. So what I did do is I applied for I don't remember if it was 20,000 or 25,000 to put back into that account. So if accepted, we would be receiving that money probably in June. But they're still looking at it. But that is strictly grant money, that DOT account. So the money that you see in there is from what was there prior.
Yes, I also had a question about the revolving account. I see that there's it says a monthly payment from them. I know that here again, it was another issue that we were always having trouble collecting money from them. And it used to be yearly, and then it got to be bi-yearly, and now is it monthly now that they are paying, and are they paying on a regular basis?
Who are you speaking about? Who is
the housing authority?
Yes, yep. So we still receive those checks
monthly.
Yep. $833. I believe it's $833, and it equals out to $10,000 a year.
Oh, okay.
So in turn, we've been working with them to offer more, transportation opportunities and things like that. So we've definitely been increasing our relationship with them, but it's $10,000 a year. So yes, we do receive that.
That's good.
But I just want to tell you, and Christine, please correct me if I'm wrong, but that money goes back into the general fund. That doesn't. Oh, it doesn't. That goes into the revolving.
Yes. So the money that we receive from the housing authority goes into our revolving account, and we hold on to that. We do get reimbursement checks from the RTA. So that covers the payroll and expenses for the RTA buses only. And that the check is issued to us, but that gets deposited back into the general fund. So we don't have access to it once it's deposited. That gets put into the pot and then distributed out each fiscal year.
Yeah. Thank you. I'll have some more questions in a little while as you go through each fund.
Well, so if you have questions, I'm not going to go through each fund in detail. That I just kind of go over the totals. If you have specific questions, now is the time.
I had one general question was, how did you decide what comes out of the general fund and what comes out of the gift fund?
So that is part of the budgeting process in the beginning of the year between Holly, myself, and when we apply for that. In terms of processing the bills, basic office supplies and things specifically for the employees here typically come out of the general fund. So if we need pens, sticky notes, tape, anything like that, comes out of the general fund. The expenses that are coming out of the gift fund are specific to programming, events, outreach, anything like that. So other things, other items that aren't just helping the office run, but extras that we're providing to the seniors. If that makes sense. Extras probably isn't the right word. I'm just not sure how to phrase that.
What's it? If I may, Shashi.
Go ahead.
I see, you know, on all the ones, this WB Mason, you know, face masks. This is from the general fund, but then you go to the gift fund and you see the same kinds of things. And that's what I was just wondering how you decided between the two.
So if I may, so Christina, I'll take this one. So occasionally we get seniors that come to us and they let us know of the things that they would desire to have at the senior center. So I'll just give you a for instance of the face masks. So originally they came out of the general fund because we just needed extra. But some of the seniors that came in were not comfortable taking a mask out of a big box of them. So therefore we needed to start, we decided to order masks that are individually wrapped. And unfortunately, our general fund doesn't really fund those kind of things. So because we looked at it also as an outreach opportunity, because if we don't have the masks, people will not come, which is why we decided to start taking it out of the gift fund. Because to get, and I'm just using this in particular, Louise, because this is what you brought up. So to have the bagged individual masks, it's more of an expense on us that we did not look to have in our general fund.
And then we get to the gift account. The total of the gift account is now 23,716, which by my figuring is about 25,000 less than it was less than 2 years ago. I'm concerned, as we had spoken a couple months ago, about how fortunate we were to have some money where other senior centers didn't have any money to fall back on during this pandemic. The pandemic is far from over. We have a long way to go, I'm afraid, the way things are going. And I'm afraid that if we don't keep some money in the gift account, we will be in the same boat that those other senior centers were at the beginning of this. I have questions about some of it.
So may I just intervene really just briefly, Louise, before you go into the questions? So one of the things to keep in mind is that we do have a Friends of the Senior Center group, the 501c3 group, that do offer the kind of programs that we would want to see in the senior center when it is an active senior center. For 2 years, it was inactive. So therefore, the expenses that came out of it. So for instance, the COA board in 2020, decided to upfront money for people to have meals. So we ended up paying for 4 months of grab and go. There is expenses there. The air conditioners, there are expenses there. Then it came that with the Shared Winter Streets grant, it just so happened that people in Shrewsbury loved the vests, and we ran out of vests. And we ordered more vests. So yes, so did the money start to go down in our gift fund? Absolutely. But the money also started to go down in the most crucial times of us still providing outreach for the Council on Aging. So I just want to, I welcome the feedback that you have as far as wondering where else the money went. I just want to remind people that we definitely were and are lucky that we have a fund, an account that's available to offer those purposes, because there are many councils on aging, just like you said, Louise, that did not have that. So we are extremely fortunate of the generosity that people have given over the years, and that's where that money has gone. Do I see this happening to continue? No. As long as COVID doesn't hit us in a different way, I don't see us needing to spend down those monies in any way. Now, in the past couple of months, the Friends of the Senior Center have been more active at the center. So we've been able to open up where there's less restrictions. Who's to say what's going to happen in 6 months from now? I don't gamble that anymore. Who's to know? But I do firmly believe that the monies were spent in a very positive way from the gift.
Holly, let me interrupt for a second. If I interpret what Louise is saying, essentially we have a document, guidelines for how the gift fund money should be spent, and if what you're spending it on is consistent with that document, and there's no discussion, which I mean, you have done your due diligence and said, yes, what we're spending is lined up with what that document says, then we don't have to have any. But yes, I understand Louise's concern that the gift fund is being depleted, but that's what money is for, isn't it? But on the other hand,
yes.
On the other hand, are we expecting any replenishment per se?
Yes. So yeah. So Shashi, so first of all, thank you for that. So I'm just going to jump ahead just for a moment and just talk about the veterans grab and go that we had last week. So there was an expense accrued there, but with the generosity of Chief Joseph and Representative Hannah Kane, they are actually giving us money back to put back into the gift fund. Christine, correct me if I'm wrong, it's just around $1,500 that is going to go back in from them, give or take some change. So yes, and we do receive donations quite frequently. And there are a few things I'm going to talk about as we get on with this meeting on how those donations are coming, like how and why they're coming through.
Judy had a question?
Yeah, I hear everything that's been said, but I think that when I understand what the need to spend it down, or that we had a need to spend it down, but I think once you spend it down a little.
Excuse me, Judy, I have to interrupt. We're not spending it down. We're just spending the needs as they arise. And spending down, I think of people going into nursing homes, trying to get.
But Louise pointed out that it's quite a bit less than it was. And so the question is whether it's going to be replenished, and perhaps a little bit of fiscal conservative, a little bit more, being a little bit more conservative with the spending of that fund, knowing that we have spent more than we've taken in the last year.
So
you want to address that, Holly?
I would very much appreciate you to do that.
Louise?
I just had a couple questions. the food pantry and event supplies that are in here. I know, I understand the food pantry. What are the event supplies? It's $1,000, $1,066.
So that was for some things for the Veterans Lunch, as well as I think some smaller activities that were happening here at the Senior Center. We do primarily order things from WB Mason because we already have an account set up there and it's very easy for us to pay those bills, whereas buying some items from other vendors is a little bit more difficult. So what happens is when I get my invoices from WB Mason, some things are lumped together. So for the purposes of my detail report here, without itemizing every single thing that we've bought, I kind of just use general terms to cover it. So I can go back and look at the specific event supplies that we bought, but I can tell you off the top of my head that most of that was for the food pantry. It might have just been small items for an event that were just lumped into that invoice.
Jean?
Yes, I was, you mentioned earlier there was a document that identifies the criteria for using the gift fund, and I'm wondering if I could have a copy of that.
Christine, can you find that document and share with the entire board by the end of today?
Yeah.
So,
Thank you.
and I do want to say that that document was put together before I came into the town of Shrewsbury. So if it needs to be revised or relooked at, I would invite the board to, give those comments.
Great, thank you.
Louise?
How much is the food pantry being used? And how is the information getting out to the community that it is available and when and how it's available?
So, so the food pantry, as you can expect, as the colder months come upon us, we are getting more requests, especially with the fact that COVID is also going up. So we have people, I would say most of the people that use it might be clients of Meals on Wheels. Occasionally we just get people that want to try it. And we don't ask questions when people come, excuse me, to request food. It is just, so for the Council on Aging and the Senior Center, as it's documented, we use the food pantry as supplemental to however else they're eating during the day, or, during the week. And then for police and fire, it is for emergency purposes. So if people are, displaced because of some kind of emergency, the police and fire have access to it. So we've been quite generous. So you asked about how are we marketing it, which I'm also going to discuss a little bit later, but I know that you saw a couple of the tables that we set up that was at the Senior Center with items that would be available if people needed food. Because even with all of our efforts to try to get the word out, I was listening to people say, I didn't know you had a food pantry. So we made it quite evident with a table that was outside that people could just take things and again, without questions. But again, in a little bit, I'm going to get into what the things are that we're doing to market the Senior Center, which we have been, I think, very successful in getting additional words out. So I would just like to table that just for a little bit, just so we can get through the rest of the finances, Louise. But if you have any other financial questions.
Well, I have a question.
Yeah.
Because right now, the food pantry is not being used a lot. But if once the word gets out and people start using it, so I have really two questions.
Mhm.
Do we have the fund? Do we have any projections as to what to expect? And if we do we have the funding to keep that food pantry sufficiently stocked? And how are we going to go about doing this?
So if you remember correctly, the reason why, or the food pantry was able to be established in the first place is because we did Feed a Senior, in which case we received a lot of contributions to it. And again, this is something that I was going to hold off and talk about afterwards, but Christine and I have been brainstorming other ideas, as well as the rest of the staff here at the center, about to support a senior. And we were going to put guidelines to what exactly support a senior means, which would include additional meals. It would include being able to heat, pay for fuel. And of course, this isn't an all summer or all winter type of thing. So it would be like a one time, and perhaps depending upon the donations we received, how much and how often we could support people at home. We've received calls where people's, pipes are frozen and they don't know how they're going to fix them. Or, we've received so many calls that we would love to help each and every one of them, but we don't have the funding to do it, which is why one of the things that Christine and the rest of my staff have been trying to sit down and brainstorm how to support a senior, which would then, initially it was going to go back into the gift fund, but Christine and I were talking that we feel as though we really need to establish an account that is strictly for outreach purposes, taking it away from everything else that was combined. Because right now people donate money or give us contributions to if somebody passes away in memoriam. We received a check from somebody just because they used some of our medical equipment. I think some of those things need to be separated from what we do as outreach specifically, which would include food pantry, heating, etc., like that. But we're in the beginning stages, because I am just now, even after 2 years being here, seeing where the needs are coming in, and would bring those changes, suggestions, I should say, to you, to the board. So these are all things that we're just talking about, but we are definitely seeing the need come across. And again, now we've had a very mild November. Who's to know what we can expect for our winter? I just want to make sure that we have the things necessary. And as Louise has mentioned, as we talked about here, we are lucky because we have the gift fund. So yes, we have the means to keep that food pantry going. And I do want to say thank you to the Friends of the Senior Center. They have started a donation box outside of in our lobby area to accept food to keep those things in our pantry. So we definitely have the means to do it as of right now. Yes.
Holly, let me ask you, maybe the board wants to think about this too. Yes, having a food pantry is a good idea, but you can see from the news that the need for food pantry usage is going up all across the board, across the country, across the state. So it looks as though we don't have a projection of the increase in need. Is that possible? I'm afraid that there's a possibility of we may be depleting our gift fund much faster than we expected. Is it time to raise this issue with it next to your boss, to the town manager level, for additional funding if that should happen?
So yes. So the other thing to keep in mind, and we talked about this briefly last month when I explained that I put in a grant for the ARPA grant, which would be additional assistance. And one of the things that I put in was to have it funded that we offer free grab and go out of the senior center / council on aging for the 4 winter months. So, and that would happen for 4 years. So, and I put it in at $1,500 a month. I have not yet heard whether it's been approved or not. Kevin, town manager Kevin Miskar, is still in the process because each department put in 2 requests. And I did just also sit with somebody yesterday from the community that is interested in creating another food pantry outside of St. Anne's for the town. So yes, that is definitely has been a discussion. That is not something clearly that we can do on our own, but yes, we are talking about it.
Thank you. Louise?
Just a brief question. How many people are in this walking club?
So I believe the first week we had 8, and now I think yesterday for Tuesday we had 6 or so. We did have a couple of people, receptionists actually, who have seen seniors walking in their neighborhood that were not, I guess, being safe. So we have given a couple of vests to receptionists to offer them to the seniors that walk in their neighborhood. Not everybody, keep in mind, not everybody comes to the senior center to go in the walking club. That can be anybody who's trying to get exercise in their cul-de-sac, in their neighborhood, or anything else like that. Because I assume that you're looking at the amount for the vests.
Well, on the grant, there was 50 vests bought through the grant. And then I don't know how many were bought here for $700. I mean, and
So-
this is like the second or third time that we have bought vests. I mean,
So-
I'm concerned that if we're going to supplement or to provide all the equipment for one club, I mean, so suppose somebody came up and they wanted to do bocce. If we get the courts cleaned, are we going to buy all the equipment for them? I mean, where do you say
So
we can't do anymore? I guess
Louise-
that's my point. We can't keep buying vests over and over again for everybody that wants one.
So first of all, you're looking at the vests in a different kind of way. The vests are actually keeping our seniors safe. So
I
that was-
understand that.
So it was in collaboration with the police department. So one of the things that was happening is, at one time we gave the police department some vests where if they saw people walking, and it could be anybody walking, they would pull over and they'd offer people a vest. And what was great about that is it was in collaboration with the Council on Aging. So I can tell you that Christine and I are also already talking with the police department, and they have agreed to pay some of the expenses for those vests. It's in motion, but it's in a collaboration with the two departments. So it's not in the walking club. So yes, even though they meet, the walking club themselves, the person that actually put the club together comes here to meet on Tuesdays. However, people walk all over the town who have called us to request a vest. So it's not necessarily just the people that are coming out of the senior center walking around. They're doing it in their neighborhoods. I actually drove to lunch the other day and saw somebody over by Dean Park Pizza wearing one of our vests. So, that's just not that one opportunity that meets on Tuesday mornings. It's a community wide. Anybody can have it.
I think maybe this needs to be, it just says for a walking club, and that's why I questioned. I think it needs to be for senior citizens rather than for the walking club.
To interrupt for a second here, I think we're trying to balance fiscal responsibility and the rate at which we're spending this money, and not to create the impression that we're favoring one club over all the other activities. But there's another way to look at it, and that is, in a way, it's a marketing tool for this senior center to have somebody walking around. Oh, you're with the senior center? How did you get that? It encourages people who are interested to contact the senior center, which is something I think is our bigger, larger goal. So it's a good thing from that perspective. Any comment from anyone?
Yeah, well, and keep in mind that, through COVID, there has been less opportunities to meet inside, and there are still people that do not want to come inside. And for us, we looked at it as encouraging a healthy lifestyle and being able to protect them and be safe. Because originally we were going to buy sweatshirts, t-shirts, and all of those things. But we thought that the protective vests, and just as you mentioned, Shashi, it's part of, one of the things that's been said over and over and over again since I started in 2020 is, how are we going to let people know that we're here? This is one of those outside of the box kind of steps.
Right.
So for sure.
Excuse me, I think we need to move on. It's almost 9:45, and we have to be done in about 45 minutes. So the next item on the agenda, do you have any more major questions, Louise, on finance?
Yes, thank you.
Go ahead. What did you have? No, you have muted it.
No more questions.
Okay, let's move on to the next topic then. Where's Virginia? I thought I saw her. Virginia joined the meeting and left the meeting.
I'm in the meeting.
Oh, good. I lost my agenda here. Oh, here we go.
We're on director's report update from outreach, Shashi.
Oh, good.
So that would be
What
Renee,
happened?
and then Renee will introduce Lucas.
What happened to Renee?
She's here. Renee, are you here?
I'm probably just on another page, Shashi.
No, but I don't see you on your image on the screen.
I'm here.
Okay, all right. You're invisible for me. I don't know
I'm
how I
sorry.
can get another. Go ahead.
I thought Holly was going to start off first, like she usually does.
No,
Oh, you want
so,
me to-
no, so you're actually the first part of the director's report.
Okay.
So you
Right.
go ahead.
All right. Thank you. Well, first I'd like to introduce Lucas Kuhn, who's here. Kuhn or Khan, I can't remember how to pronounce that. I apologize, Lucas. He's from Quinsigamon College, and he's our intern who started out with us in September and was going to be with us for a half a year. And now we've gotten into a project with him to help with outreach, and he's agreed to stay on for a full year. So we're going to be devising other projects for him, hopefully, for him to do. So Lucas, say a few words to introduce yourself and maybe what you've learned a little bit and what you're working on.
Thank you, Renee. So yeah, I've worked in human services now for roughly 7 years. I've always been passionate about helping others since I was a teenager. I've always believed no matter what the age, we all deserve to live happy and purposeful lives. I've worked with many different age groups in various congregate care settings, including teenagers and adults with physical and mental health limitations. And I'm honored to be working with Renee, and I just hope that I can be of some value here at the Council of Aging. And yes, I am currently working on a project to be announced next meeting. So I will wait until that time.
That's great, Lucas. Welcome.
Thank you.
Okay, thanks, Lucas. Yeah.
Is there any reason why we can't get the title of what he's working on? Why is it a mystery?
It's not a mystery. It's called Yahoo. It's youth assisting and helping out others, or
Okay.
Young adults helping others out. Yep.
yeah.
Okay.
Yeah, kind of like a little bit, not to give the whole thing away, but a little bit about that. We do get requests coming in beyond small home repair
Mhm.
for other things like helping with landscaping and maybe shoveling or plowing. And we're just looking at different things that youth can help out the seniors in town with.
How about the Boy Scouts?
Mm-hmm.
Yeah.
It has to be a program that's devised with teams and adults who are supervising.
Okay.
So yeah, we have to take great care in doing the program in the right way.
Right.
And yeah. And on that note, for small home repair and the people who make requests, we are getting a lot of requests for recommendations for plowing from seniors. And I really don't know what to do with that. I don't know if people have resources or others that they know of who are in the business that beyond the landscaping part of it, beyond the person calling up a landscaping firm and saying, can you do plowing? And one person told me that they got really astronomical quotes, for that. So I actually, interestingly, one of our select board members in Shrewsbury stopped in yesterday to introduce himself to me, Mo DiPaolo. And I was talking to him about the problem, and he said that he would like to look into actually what kind of, how can we address this, at the municipal level with the Council on Aging.
Renee, I have an observation. In my travels during Meals on Wheels, I have come across elderly people, homebound people, who are taken care of by their neighbors, who just come over and plow their driveway for them. And there are enough retired people out there who own pickup trucks. And I was wondering if you would like to make an announcement that we need volunteers who are willing to plow for seniors. Just see if you get any response. Just a suggestion.
Volunteers for plow drivers for seniors?
Yeah, they have their own truck, and if you want to do once in a way on demand, and somebody who's stuck, somebody who needs it, they'll just do it for you.
Yeah.
If there are volunteers.
I
Holly,
think Holly has a thought on that.
Well, so last year what we did do is we had a couple of companies call us and say that they would help. However, there's a few obstacles because we don't want to give advertising and make one company bigger than the other company. So the way we worked it last year under the direction of town management was if there was an individual, even if he owned the company or she owned the company, that was willing to plow, we could mention their name and their phone number, not their business name, but we can mention like their personal name and put that in there. And we did have a couple of people that did offer to do that.
Judy?
Yeah, if you're going to do that, I suggest you make sure that the plow drivers are insured.
Good point.
Okay, so moving on, fuel assistance applications are kind of trickling in slowly, and I have some people who have made appointments for the month. So compared to last month, we did 3 more applications, and we also have the Share the Warmth applications now. So we'll be doing outreach on that. And I have in January's newsletter, there'll be a write-up. I mean, we have been advertising fuel assistance, but I actually have a write-up going in, and that's also been being shared in social media and different places. Also,
Renee, before you go further, fuel assistance funding is coming from Share the Warmth entirely, or partly Share the Warmth and partly
no.
not?
So yeah, so fuel assistance is out of SMOC that we make the applications for, and then Share the Warmth is through a fund that Selco has raised money for to help people with their electric utility bills. And they take applications through March. I can't remember the exact date, but it's in March sometime that the applications are due, and I submit all of them. They only want them all at once the week before the due date. And however many applications come in, they divvy up that year's funds among those applicants to help defray the cost of their electric bills.
Do you have any provision for emergency fuel assistance?
So we had a recent meeting conducted by our town assistant manager and Holly on on the, I don't remember the name of the fund, but through Al's Oil, basically people who are waiting for their fuel assistance to come through, it can take a long time. And when they run their oil down to, I believe it's an eighth of a tank, right, Holly? An eighth of a tank. Then they might be eligible for a emergency fuel oil delivery of 75 gallons. And at that point as well, and that goes in an emergency right away, within a day or so or two. And at the same time, SMOC is notified of the emergency, and then they would expedite their fuel assistance application so that they would get, the funds would become available so that they don't run down again. And that fund is available only for no more than 2 years in a row to a single recipient.
Virginia, did you have a question? Virginia, are you there?
Yes, I'm here. No question right now.
Okay. So that's Share the Warmth, and as well as that the Emergency Fuel Oil Fund. Any more questions on that? Okay. So we started the Savvy Caregiver class. Finally, I have 10 participants that started. It's going to be Mondays, each Monday for 6 sessions. And what's really great is I actually have 2 families who are attending. One is a woman with her son's partner who is helping to take care of her mom. And I have another couple, a father and daughter, who are taking care of his wife and her mom. And they're going to be learning about the progression of the disease of Alzheimer's or related dementias, what happens to people cognitively, how they communicate and how they receive information, that's communicated to them and about their environment. And then, through learning in the class as well as from each other, help devise strategies that can make life easier for them and, with their loved one. So we started that program. And in addition, we do have a lot of good caregiver resources that I've been giving out to people as needed. There's a lot of need out there for caregivers. In addition, we started the new grief and loss session. So in addition to the one that we have that has 12 people, we have 8 people in the second program, and that's going really well. Additionally, with SYFS, they started Living Your Life Well. Oh, they're actually starting it this week on Thursday. It's going to be a weekly drop-in program for people to kind of just discuss. It's not a support group, but just kind of discuss, issues around, senior issues or anything in the news, things like that, things that are on their mind. And also, for the last 2 weeks of October, I worked on a grant and submitted one with the Greater Worcester Community Foundation. And that grant would be, if I was awarded that grant, or if we were awarded that grant, would be for $25,000 to, and the project name is called To Improve Health-Seeking Behaviors and Outcomes for Low-Income Households via Access to Technology. So basically, before I joined the Shrewsbury Council on Aging in my position, I have been part of a Human Services Coalition group that we meet every Friday morning at 9:00. And during COVID in particular, we've been talking about how do we reach people in need remotely, and the difficulties with that. How do we reach people with health programs and wellness calls and things like that, beyond phone calls, to give people socialization, health information, that sort of thing. And of course, it's been difficult for people to have their doctor's appointments, and telehealth became more popular. So back in February, I asked one of our representatives who attend the group if we could devise a bill for the Massachusetts legislature to provide free internet for Massachusetts residents who are receiving benefits like SNAP and fuel assistance and things like that. And then we decided to narrow the bill to providing free internet access to people in public housing in Massachusetts. And that bill actually got a hearing this past October 13th. And I submitted testimony for the hearing as well as the rep and others. And so that gave me the idea when I saw on the Greater Worcester Community Foundation a Fallon grant that they're looking to reach underserved individuals with community programs that can help facilitate healthcare access. And one of the areas that they're funding is technology, access to technology. So all of these things have kind of converged. The federal government through the $1 trillion infrastructure program wants to provide increased broadband access. Different organizations have, and including the World Health Organization and others in the country and around our state, have said access to technology is a social determinant of health. And so I decided that I thought this grant would be applicable as a pilot program in Shrewsbury to provide, the 25,000 would provide 45 residents in town with free broadband, internet, and Wi-Fi access, and is to facilitate access to patient gateways, to telehealth, health education programs, as well as socialization with their family members to help promote health in seniors in particular. Oh, you're muted, Shashi.
Virginia, go ahead.
So along with the broadband, which is a great idea, is there money that also gives them an iPad or something? I mean, if you don't have anything
So
to
part
do
of the
with
part of the grant would be I actually partnered with Elder Services of Worcester area, because coincidentally they had written a grant, another different grant to Fallon to provide technology, and they didn't get the grant, and they were really disappointed. And that was very recent, but they did get another grant for a part-time technology assistant to provide to their consumers who are receiving services access to iPads through their home care program, as well as access to trainings on how to use the devices.
What about UMass has a large community benefits program. Do we benefit at all from them? Because I would imagine, I mean, one of the big aspects for all these community benefit programs, because me, I came from that. That's how we knew each other. Is focusing on working with underserved populations, and certainly, I'll be quick. I saw your note. I think one of the issues, especially for individuals who are not so much homebound, but certainly don't have transportation easily, that certainly having an iPad and being able to circle back to your physician means that sometimes you really do need to get into the office for some things, but a quick check, that's the best way to do it.
Yeah. So
Excuse me.
Yeah.
This may be a bigger discussion than we could resolve right here.
So basically,
we got to have a whole plan in place as to how do we select people, how do we train them, what do we train them in, it's not something we can actually need to discuss here.
Right. So Shashi, let me just address, what the grant specifically covers. So the grant specifically covers internet access, which is an issue for a lot of people. They may have a smartphone and they may have an iPad, but if you're not able to afford internet access, that's a problem. So it covers that. And also ESWA will provide a technology person to provide 3 hours, 1 day a week for 3 months of training to individuals who would be part of this program. And they will also provide iPads to their consumers, which they can do through their home care program. And they will also provide, I guess, from another fund that they have, iPads to other consumers who would be part of this program.
Renee, can we table this until we
Sure.
actually get the grant?
Yes,
Just because we're running out of time.
I know.
Yeah.
I only wanted to give that.
Scheduling has been a major bone of contention, upsetment among some people. I think we need to spend some time on that.
Okay,
that-
so I mean, that's really basically what I have. And I just wanted to say a word about the food, the food sharing pantry is that we encourage, people will come when they feel that they're, spending their money down towards the end of the month and they don't have enough money for food, or because maybe they've gotten out of the hospital and they need, initial help with meals until the Meals on Wheels can get established. What we try to do always when people make a request, because it is an emergency on an emergency support basis, is to try to make sure they understand that they can be connected to regular Meals on Wheels if they're eligible, but also that they can do the grab and go, and that's that doesn't require any eligibility if they have a regular need. So that's how that's usually done.
Virginia?
Oh, no, that's it.
Okay, all right.
So,
All right.
and I'll be happy to, I'd love to talk to Renee more about this because this is really passionate.
It's
If I
a
can
bigger-
help,
it's
I
a
will be
much
happy to
bigger
help.
issue than we can resolve here.
Yeah, actually,
Holly,
Virginia, I'd love to talk with you offline, so
Yes.
call me anytime.
Holly, do you want to move on to the next topic, the Shine scheduling?
Yes, please. So, Shine has definitely it's kept us busy the last couple of months, and there was open enrollment that happened, and I know that Judy had reached out with some suggestions on how to work with the Shine counselor to make sure that people that were coming in were, the people that really needed to get in touch with the Shine counselor were the ones that were being seen. So I have met with the Shine counselor a couple of times, so has Christine. And so I wish we had the information sooner than what had happened this year. And it's kind of like a learning curve. So the way we're doing it now, per request of the Shine counselor, is that she's given us a few questions to ask people when they call in that want to have an appointment. Now, keep in mind that the Shine opportunities that we have here are all completely volunteer. These, the counselors that come in, they're not paid for. Typically, they are only here twice a month for 3 hours at a time. And for the month of November and December, for the month of November, she gave us 4 other dates, or 4 dates all together. So 2 more in addition to what she was giving us. So now the questions that she suggested that we ask are, are you 65 or will you be 65 within 3 months of the appointment? If it is no, you have to wait until you are 3 months. If you are not eligible for Medicare, that is also a reason to not meet with the Shine person, because Shine is strictly Medicare. It doesn't talk about other insurance opportunities or anything else like that. There are other opportunities. Fallon offers some. They've offered to come here a couple of times, but again, you have to have Fallon. So I don't know, Judy, if when you were called, when you called the senior center, if they offered couple of questions that they might have asked you.
Well, finish what you have to say, and then I'd like to speak to this
Go ahead.
briefly, but I would like to speak to this.
No, that's pretty much all I have.
Okay. Okay. All right. Well, just Shine is really important. Shine is when you're 64, turning 65 and enrolling in Medicare. And as far as the Council on Aging, it is for many people the first encounter they have with the senior center. So, you know, when it's negative, it leaves an impression. It's also a government program, and we have to make sure we are administering it properly. And what happened, I'll give you real quick, is I am turning 65. So I need to enroll in Medicare. So I wanted a Shine appointment. I couldn't get one in September, couldn't get one in October, tried to get one in November, and I was told by 3 different people 3 different things. I was told by one person that as soon as the newsletter is mailed, I should call. And it usually gets mailed around the 25th. So call at 8 in the morning on the 25th, 26th, 27th. And, you know, hopefully if it's mailed out, we can make you an appointment. I was told by someone else that when you receive the newsletter, that's when you can make an appointment, and that as soon as I receive the newsletter, I should call. And then I was told by Holly that, in fact, if you call at 8 a.m. on the 1st of the month, you can get an appointment. And I should set my alarm for 8 a.m. Now, it's problematic because inconsistent information was being given. And it's problematic because that system does not allow for people, what if you work and you can't call at 8 in the morning? You know, and it also doesn't prioritize people appropriately, because the people who are turning 65 in the next 90 days or whatever, you know, time we can set on it, those are the people who should be prioritized. And it's stressful. You know, why should anyone have to set their alarm, you know, repeatedly at 8 a.m. to like call and, you know, stress about getting an appointment? So I have several suggestions. The first suggestion is that anyone who's turning 65 should be able to call and get their name on a general list. Give your date of birth. The list should be prioritized by date of birth so that whoever's turning, you know, 65 soonest gets the next appointments. And that there needs to be transparency, and you need to know how many people are on the list ahead of you. And, you know, you don't need to know their names, but where you are on the list and when you might get an appointment. And I think that will reduce the stress and will make it more streamlined. And, you know, no one has to, you know, obsessively call at 8 in the morning for, you know, days in a row. The next thing what happened was that after doing all of this and, you know, making 8 million calls and finally getting an appointment, I got a call like 10 days later telling me my appointment was being canceled because they have prioritized it. And so whatever, which, you know, honestly, if I wasn't on the board and this was the first encounter I ever had with the senior center, I would be done with the senior center after this. I mean, you know, I spend months trying to get an appointment and then I'm told it's canceled. Okay. But I think that means that you are prioritizing it by date of birth, which would be the way to do it. But you need to put out that information if that's what we decide to do, that's how it's being done, that there are limited appointments, because the newsletter says, make an appointment, they're available. And, you know, it doesn't say they're limited appointments. You may not get one the first time you call. You know, you need to manage people's expectations. And the other thing is, there was a news flash sent out about the Shine appointments. And the news flash says, Shine is not for people turning 65. It is only for people who are already enrolled in Medicare. And if you are turning 65 and want to enroll, you should call the Health Connector. And that's really incorrect. Shine is a government program. It is specifically for people who are new to Medicare. During open enrollment, they also help people who are already on Medicare, but the program is designed for people who are turning 65. So that newsflash was problematic, and I think it needs to be corrected because you just told the entire population of Shrewsbury or whoever subscribes to that newsletter that if they're turning 65, they are not eligible for a Shine appointment, and that's incorrect. And to call the Health Connector, which they don't, that's also incorrect. So that's all I have to say about it. I would like to see it prioritized by date of birth and be an easier and less stressful sign up process for everyone.
May I make a few comments about that? Thank you, Judy. But it seems to me that we have a couple of different problems all blended together. One of which seems to be the shortage of counselors. And the other is scheduling and the systematic way of scheduling people who do. They are two different. So Holly, is it possible to raise the level of this also up to the town manager and see if we can get either volunteers from the neighboring towns or someplace else to get more Shine counselors
Oh,
available?
can I say something about that? I'm sorry, just because I
Go ahead,
just
Judy.
investigated the whole Shine thing, so I know. It's actually run Central Massachusetts Shine. If you live in this area and you call Shine, they refer you to the Milford office. So that's where most of the appointments are apparently being made. So I guess one thing we could do is tell people if they can't get an appointment in Shrewsbury to call the Milford office.
So if I may, Shashi,
Go ahead, Renee.
because I've dealt with this a lot too in with some of the issues at the front desk, which I believe have been resolved now. And sometimes I get calls transferred to me because people ask about something and then they're going to ask about Shine. And basically, what I tell people and what the front desk should be telling people is that they can make their appointments starting on the first of the month. However, there are a limited number of appointments, and the front desk will give you an alternate number, which is the Milford number, that you can call, and hopefully you can get some assistance over the phone. I have talked to the Milford people, and they said that that's what they do, that they will try to provide assistance over the phone. But if they can't, they will actually send the person back to the town, to Shrewsbury. And I don't know what they do beyond that when people are running up against the deadline, if they can't get an appointment where they're such limited, if they do send people back. That's one thing I don't know.
So
Have we
I just wanna-
changed that
can I just-
system?
Okay, can I just make a comment? I just need to make a comment quickly because I'm enrolled in the Shine training program. There just are a lot of people that there wasn't any Shine training now for a year and a half. So they're just bringing on board a lot of people. And so I think that some of this might be changed. And certainly it's just also educating on the process because when I was out toward the Neshoba area, most of the senior centers there had somebody on staff who had kind of a dual role. They were Shine as well as doing something else at the same time. So they were available all the time. So I think it's something to consider on how we better address for Shrewsbury. And certainly I'm more than happy to be poking at the person who is the director over at the Shine Center in Milford, because she's the person who's doing the training.
Judy, you have a question?
Yeah, have we changed the way that because Renee just said that you're supposed to call on the first of the month, but apparently that has been changed because I did call on the first of the month. I got an appointment and now I was told that it was canceled because they're prioritizing by date of birth or only taking people who are currently enrolled. I don't know why, but are we, what system is being used, and do you think you can consider my suggestion of just one call, I'm turning 65, this is my date of birth, and prioritize it that way?
Holly?
So the reason why we have people call on the first of the month is because what was happening even last year and the first year that was here is if we released the dates that the Shine counselor was going to be here prior, like in months in advance, people were booking them. And then what was happening is some people that weren't getting the information at the same time as somebody else didn't have the same opportunities to make those phone calls. So the only way that we could figure out on how to do this is I don't release when the Shine counselor is going to come each month. And I release it the day before the first. That way, everybody has the same opportunity to make those calls. I agree. There are people that are working that might not be able to call in. When Shrewsbury has one Shine counselor who again, is a volunteer, and she's only able to be here 2 days a month. And let me tell you, we are in a shortage of shine counselors. So I've tried to get additional ones. I've tried to do one a week, and it's not available. That is completely out of my hands. There's nothing I can do about that. So with the opportunities that she is available with, she's came into my office, she sat down, and I said, okay, so I'm like, how do we know who needs to be seen, and like whose information is more important than the next person? As when we only have 2 days out of the month to do it. So what she suggested was that she will allow and see people that are going to be turning 65 within 3 months and or has Medicare, who is already 65. So I did not make those rules. That is something that came from the Shine counselor. And again, our phone rings off of the hook. And I do want to let everybody know is that the Massachusetts Council on Aging is aware of this issue. We are not the only senior center. We are not the only town that is struggling to have the work that is offered to us from them come here. So I don't know where MCOA is as far as getting us additional assistance, but this is what we have to work with. And I know that it is frustrating, and it's frustrating not only to you, Judy, but it's frustrating to us over here because sometimes the information changes and our phone rings off the hook, but there's nothing that I can do to increase those opportunities.
Judy, go ahead.
I know you can't increase those opportunities, but your phone would not be ringing off the hook if you simply let people call once, give you their date of birth, put them on a list, and prioritize appointments. You can have the Shine counselor or somebody call them and say, okay, we've got appointments in November. You're third on the list. These are the dates. And it would make it more accessible for anyone who can't call at 8 a.m. necessarily, and your phone will not be ringing off the hook. I'm not sure why.
So I completely agree. When you sent over the email, the first thing I did was I sat down with our Shine counselor, and I said, I'm like, we need to fix these issues. And prior to you sending out that email, we weren't asking people what their ages are, but they did say that they will only meet with people that are going to be turning 65 within 3 months. Christine, do you want to go ahead and give an update on what we're doing with the receptionist?
Yes. So I just wanted to point out, I have made our little Shine Bible here, if you may. So this has all of the information on Medicare eligibility, as well as the appointment books. Sorry, Shashi, I keep getting feedback from you. I'm going to keep muting you. I'm sorry. So it has the Medicare eligibility. It has the appointment signups. It has a wait list. It has all of the questions that the receptionist should be asking. So this is, aside from me answering every single phone call, this is kind of the best that I can do to pass along that information. Our receptionists are amazing, and we are so lucky to have them. But I don't necessarily have the time every day to sit down with each and every one of them to make sure that everybody has the same understanding. So I do my best to give them that information. And I apologize if anything gets misconstrued along the way. I'm playing a game of telephone with some people that I tell one receptionist and then they fill the next person, and some things don't get passed along the correct way. So I bust my butt, if I may, to put together these binders and get everybody the information that they need. So I'm hoping going forward, this process is a lot easier. It has become a pain in my butt too, I'm not gonna lie. So I'm hoping that going forward, this is more seamless and easier for the people who need help, because I agree that this is a very important program and it needs to happen fluidly.
Judy has a question.
Yeah. It's a process of managing people's expectations. If you tell people that you have limited appointments, then they know that, and the newsletter doesn't, make that clear.
So if I may, when people call, if in the beginning of the month, great, we'll book you if you fit into the eligibility. Shashi, I'm muting you again. And if they don't, we do explain we're putting you on the wait list. I do have all of the information on where they can go in the meantime, including the Milford number, including if you go online to shinema.org, they do weekly Medicare 101 Zoom sessions. So I know Zoom is not accessible for everybody. If you have a family member or friend that can help you get on there, I think it's a great resource. They have time for question and answer at the end. It's about a 2-hour session. We were looking into hosting them here at the Senior Center in November, but unfortunately, the times that they were offering the sessions didn't line up with our hours. The only one that would have worked was on Veterans Day, and we were closed. So that is something that we're looking to do in the future, just to have an open session. People can attend and view it on our big projector, and it's a little bit more accessible for people who are uncomfortable on a computer. It's just unfortunate of the timing of when we kind of figured out all of these things, that it was in the middle of the unenrollment or open enrollment period. But like I said, we're doing the best that we can to get the information to people. And I do apologize if there was any kind of misunderstandings along the
No
way.
apologies necessary. I have one last thing, and it's getting late, and again, we need to move on. But one thing I just want to circle back to one thing, which was the newsflash that went out that says very specifically, Shine is not available for people who are just turning 65. It is only available for people who already are on Medicare, which is incorrect, and that needs to be, in my opinion, that needs to be corrected. I think you need to tell.
So I have already taken
information about it.
I've already taken that down. So that's no longer out on our website.
Well, can you put, but the newsflash is still there. The newsflash went out and it wasn't, clarified.
I can send out a clarification newsflash, but
I wouldn't know
either.
either.
At this point, open enrollment ends on the 7th. And I know we only have a couple appointments left.
But
so
it didn't say that during open enrollment, it's only for Medicare enroll. It said.
So I will send out something to
general.
clarify that.
Yeah, I think, honestly, I think that needs to be done.
I have a question. Does anybody know if the state has any on its website, maybe? Is there anything that people can do online instead?
Yeah, well, there's shinema.gov, I believe is the website. I'm I could be a Shine counselor at this point, I think. And as either Christine or Renee said, they have monthly or maybe weekly Zoom programs of an Intro to Medicare program.
Just one last comment. Being a Shine counselor sounds like some very simple process. It isn't.
I'm sorry. It was.
Oh, no, I understand that, but I think that's why I just need to explain why it's taken so long. And I'm hoping that by next year, which is soon, that there'll be more availability and certainly a way to better serve, and certainly and Renee, I'll just keep dumping on you and Christine, throwing my thoughts, between my own background and trying to get this as well, and how we can better serve the community, because certainly our goal is to get people interested in coming to the center. And certainly, even though you might still be working when you're 65, like as Judy's pointing out, you still have to worry about Medicare, because you have to sign up or you're penalized. It's a very strange healthcare system, believe me.
One other thing you might want to consider is that when I retired, I did not see a Shine counselor because my company sat me down for an hour and went through my entire process. And then they gave me all the pertinent information that I need to go and apply for Social Security. So I'm just wondering if people have considered talking to their HR department if they're approaching retirement.
Shashi, I hear what you're saying, but that does not happen at every location. I will tell you that in all honesty.
Okay.
It's you had a good company that had an HR department that understood the transition. Some places, even if they're large, do not have that available. So it's important that you have all these options so people understand what they need to do and why they need to do it.
All right. Before we leave this, I'd like to leave this topic and move on to the next item. But what conclusion have we come to? Yes, it's a mess. Yes. What are we going to do about it? I don't know if Holly wants to address that or Christine. I know how Christine is putting together a package, and hopefully the seniors who get this package, who need it. Beyond that, is there anything else we need to talk about? Holly?
No, this didn't happen last year. And it was already the majority of the appointments when I started, in the January before that were already done. So this is a learning curve for us. Clearly, we've had some good discussions here, and we're already in the process of fixing it. So this is going to happen. And I'm just hoping that from here it will improve. So that's what I have left for this topic.
If I think we need to move on, it's almost, oh my goodness, it's 10:28. 2 minutes left on the next item on the agenda. I
So
think
it's-
Holly,
Yep.
the COA brochure and so on, door hanger.
Yep. So, so talking about the COA brochure, the door hanger, the newsletter, we put together some window stickers for to just try to increase the marketing that's going on over here. Louise, I know that you sent me an email regarding the brochure?
Yes, looking on the page where it says who we are and the description of the board, there's no place that it says that we are an advisory board. I would love to have that word included in there someplace. It says that we discuss things, but it doesn't say that we are an advisory board, which is what we are, as we are established. We have been established as an advisory board. That's the major question statement that I had to make.
Virginia, did you have a question?
Nope.
Yep, I can easily add that word in there, Louise. Thank you.
Thank you.
Was there any other comments on the brochure itself? Because we are planning on having those go to print.
So are they just going to be left at the front desk?
So there'll be some at the desk. We're going to put some at the town hall. We're going to place them kind of where all of our newsletters are right now. So we won't leave stacks and stacks of them, but they'll be in the hot spots of the town.
Louise?
Speaking of newsletters, have you thought anything more about increasing it to 20 pages?
Well, as I mentioned in last month's meeting, that it's under a contract of 16 pages right now, and that does not change until June. So, and evidently LPI is going through some staff changes also, but I will suggest going to 20 pages, but I also want to just have people keep in mind that with an extra 4 pages, I will need assistance in material to put into it. Because right now it's me, myself, and I that is pretty much doing it. So I've been increasing the font and things like that for sure. Louise?
I just wondered if there would be any value in putting in a brief summary of our board meetings in the newsletter.
I don't know that would be a good idea. What would you do? How would we ever decide what is important, what should go in, and what is not? So I think having the meetings recorded and on our website as well as YouTube in the town website should be suffice. I want people to attend these meetings and listen to them and call us. And I'll tell you what, I do get a lot of people that call and say that they find the meetings interesting and educational, informational. But I don't know that that's something that I want to put into a newsletter.
I agree. I don't think it belongs in the newsletter. It's just, newsletter is just that, the news.
So just to go through this, did anybody have any questions on the door hanger?
I thought it was a great idea.
Thank you. I appreciate that. Any questions on how about feedback on the December newsletter with the information?
I thought it was amazing.
Thank you. Louise?
Jumping ahead to the bear hunt, what are going to be the prizes for the bear hunt?
So we are actually still in discussion about that. It doesn't need to be giant or anything else like that. We just want to have people happy that they participated. I'll tell you what, the very first day we put the signs out, we actually were not able to put the one, was it Lake Street, Christine? Because of the road construction, we actually had people come up to us saying that our sign was missing and the signs weren't even up for 6 hours at that time. Last week we had a father and his young daughter. She was probably 6 years old, and they came in to get gummy bears, and she had binoculars wrapped around her neck because she went bear hunting. So Christine is monitoring people that are signing up. We have a lot of people that are actually participating outside of Shrewsbury. So we'll once we have all of that data, we'll be sure to share that in the December meeting. But people have really enjoyed it, and they're coming into the center. So that has been a lot of fun. As a matter of fact, even Parks and Recreation said that they were sitting at one of the sites one day, and they actually saw like a family of a minivan with kids that just poured out of the minivan, taking a look at the sign. So the QR codes are working now we're going to be using the QR codes to get to our website in more places. As you may have noticed at the back of the December newsletter, it's there. It's on the brochure. So, increasing the marketing of the COA for sure. We've got, I don't know if people can see it, but we have we saw, I don't know, I think it was like 2 or 3 weeks ago, Christine said, you know what? The Shrewsbury Public Library has a bumper sticker or a window tag. We should have one. Absolutely. And so it has our address on it, it has our phone number, and has our sunflower. So those will be for free throughout the town too. I do just, and if nobody has any other questions or anything about the brochure or anything like that, I do just want to jump down to a couple of the programs that are happening for December. So just going really quick. So we are offering, actually, you know what? Even more importantly, in case we don't even get to it again, but I want to talk about the Veterans Luncheon.
Holly, and I want to make a comment as well.
Sure. Do you want to go first?
Well, it's about the Veterans Luncheon, and I just wanted to mention and make sure that we get it into the official minutes. Congratulations to Holly and to Christine and to the staff and those volunteers who were there that day. It was an incredible and impressive job of planning and then delivering on this major program. Louise and I were there volunteering, and we watched from the beginning. It was exhausting work, and it was really rewarding work. So you guys did a phenomenal job. So congratulations. And my hope is that going forward, when we have programs that are sponsored by this Council on Aging and the Senior Center, more of us, the board, will participate.
Thank you, Betsy. The day was amazing, and we're still getting phone calls from people. We've received comments. One gentleman, he called us and he said that the most important part to him was we had a receiving line where we thanked people for their service. He was overwhelmed with that. We actually had a wife of a veteran call us, and so Representative Hannah Kane was giving out flowers, and she called us just to say thank you for the rose that her husband brought home from getting the grab and go. It was definitely an overwhelming opportunity, and we had music here. and everybody was extremely grateful. And again, I can't thank even the volunteers that, I mean, they were here as soon as we started, and they were here even after we cleaned up. So it was definitely a great event. I'm looking forward to next year for sure. So I did just want to, mention that. I'm just going to keep going. We already talked about the bear hunt. We have a holiday lights tour that is coming up in December. And so Christine has put together a link on the website to ask people, the rest of the Shrewsbury community, if they're, dressing up their homes, or if they have any kind of light spectacular going on, to share their addresses with us. And, we're going to send out our vehicles to go out, and we're going to pick people up here at the senior center. They're going to go out. We're going to give them hot cocoa. They're going to go enjoy the lights. They'll be out for an hour and a half or so, and then they come back. So we have 4 dates scheduled in December for that. And we're almost booked already. So if people are interested in doing that, they should definitely give us a call. Anybody have a question on any of those things that I just spoke about?
I have one just brief question suggestion.
Mhm.
I'm not going to go on the lights tour, but I think there's a number of people like me that might want to see them on our own. Would it be possible to publish in maybe a news flash or in the newsletter, if there's time, the locations that are going to be covered on the tour, so that people can do a self-tour?
So the way we publicized it, Christine, stop me if I'm wrong. So the way we publicized it was the fact that if they gave us an address, our vans would be identifiable, just because it says Council on Aging. So I suppose we could tweak it a little bit. Christine, what's your?
Yeah, so we sent out a news flash, and the town manager's office has been publishing it on the town Facebook page. I did specifically state that we wouldn't be releasing the addresses if people submitted them. I mean, I can amend it to say.
No, that's fair. That's fair.
If you would like us to, we can, and put it on their plate. But I did originally say we would not be releasing a list.
Yes, then don't.
Holly, I have a suggestion. Since many of our seniors are in fact homebound, would it be possible to get Shrewsbury Media Connection to go around and videotape a video guided tour?
So one of the things that Selco offers, and again, Christine, correct me if I'm wrong, they offer a prize for the people that decorate their homes. But again, they don't ask for addresses. They ask for them to send pictures in. So I think that's a little outside of what I could probably put together, but I can certainly bring it up to the rest of the departments when I speak with them, to see if maybe there's something that they can do on their part. So I don't know the answer to that, Shashi, but I will definitely share
Okay.
that.
Go ahead. I think we're done with number 4 now, unless someone has any other questions. We can. Jean.
I just need to, I'll leave the meeting. So I just wanted to thank you for conducting it. I think that the work done on the brochure and all of the outreach for making us more apparent in town is just wonderful work. But I do need to say goodbye for now.
Thank you, Jean.
Thank you for joining.
Bye-bye.
So the only thing we have left on the agenda is to discuss the transportation. So we did share the updates on the transportation, the rides, and they were also inside the December newsletter. Does anybody have any questions on that?
Louise, go ahead.
Okay, I didn't unmute myself. I just want to very quickly say, MCOA has been, I've seen several different programs that they are offering for transportation. The thing that we have Route Match, and we're looking around, and they're offering all different kinds. And I don't know if you look into any of that, because to give us some information on alternatives to what we already have.
So Louise, I think that's amazing that you brought that up. In fact, Cynthia is going to be one of the speakers at the MCOA meeting to talk about how we utilize route match, because I myself have been looking and scheduled to meet with a couple of other directors that use other things. So just keep in mind that one of the first comments that everybody says to us is that we're on a much larger scale than other towns. So we need to just keep that in mind.
Yeah.
So I'm glad that you would get those emails. So we are in fact already doing that. Shashi, just before I forget, before I don't want to forget this, I'm actually going on vacation. I'm leaving on the 19th and I come back on the 29th. I am, however, still going to bring my work phone because that's just what I do. But so the next person to, like, if something comes up, it would be Christine. And then from Christine, it would be Kristen Lass. And then it would be Kevin Miskar. So that's kind of like the link of who people would need to get in touch with while I'm gone.
Which means that you're leaving on December 19th,
No. I'm leaving Friday morning.
and then you're not going to be back until December.
Nope. So I'll be back on the 29th. I'll actually be working from home just because of the way the COVID restrictions are, because I'm actually traveling out of country. So, but I'll be working from home that Monday and Tuesday. But like I said, I will still have my phone on me because I cannot not watch my emails.
All right. So that's for 29th of November.
Yep. So 11/19 to 11/29.
Okay. That's fine.
So I guess with that, we're just a little bit over, but I think this was a good meeting. So if does anybody have any questions for me, Christine, Renee, anybody?
The only thing I would say is this shine thing really bothers me. And I think we should not drop the ball on this because it's a major, major thing for people who are making, it's a period of transition. And the transition is never easy. Virginia, you have a question and a comment.
Oh, not a question. I jotted down notes for myself. I'm going to reach out to Renee. I think between the two of us, we can start looking at this as I'm training. And also because I have now access to other people to start raising these questions, because that certainly is a big issue. And I know how important it is, especially as Judy pointed out, and from interactions I've done in the past with people, just trying to understand and navigate what happens because of the limitations on time frame, and also more importantly, the negative impacts of not signing up when you're supposed to. You were lucky because your company did this for you, but it's really more complex than you think, depending on whether you continue to work, et cetera. It's just craziness. So I think whatever we can do, and again, also pulling Christine, because she's put things together, and we know what can we do at the desk, and how do we improve this so that we're better serving our Shrewsbury residents.
No, the only reason I brought that up is because people are still working, they might want to take the effort and contact their HR department and see what they'll do for them. Because as you can see, with the state, it's a bottleneck.
Well, right. But I think the thing is, if we have some other ways that we can start working or to find more availability, sometimes, your conversation with the Shine counselor, if you were turning 65 and signing up for Medicare, could be a 15-minute call. And if you're still working, looking at how that could be done as an evening discussion, just to get you started on the right path.
Right. It's not a simple thing. I know they sat me down for over an hour, but anyway, if there are no other topics, anybody have any questions? One of the board members can make a proposal to adjourn.
Great. So moved.
Seconded?
I'll second it.
I'll take a voice vote. Judy?
Yes.
Betsy?
Yes.
Louise?
Yes.
Virginia?
Yes.
The motion is carried and the meeting is adjourned. Thank you, everyone. Have a nice Thanksgiving.
Thank you.
You as well.